You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, go ahead and introduce today's guest, please.
Hi, I'm Ivan Zach, and I'm happy to introduce a friend of mine and a colleague, Dr. Apryle Horbal. We met a couple years ago when you started a hospital in Pittsburgh, and right now you're full-on techie as well. So we're going to talk about remote diagnosis and zoonotic disease management. On the business side of things, Apryle is a president of VetNOW, all-in-one virtual clinic and collaborative platform. She's equine veterinary dental specialist with University of Veterinary Specialists. She's a member of Pennsylvania Board of Veterinary Medicine. She's a VMD in veterinary medicine from the University of Pennsylvania. On the personal side of things, which is also professional, she gained her degree in equine dentistry. She did residency in University of Edinburgh, where she also got master's in philosophy. She had two quarantine projects that would like to consider a success: learning to drive a car with a standard transmission, which is pretty cool, and breaking and training young thoroughbred to be ridden. That's awesome. Work-related, she's one of only 17 equine veterinary dental specialists in the US, and it's a very new specialty. And she will continue practice clinically as she's able, since there's so few of them. Welcome to the show, Apryle. It's good to reconnect with you, and good to see that you're continuing with VetNOW. I met you through your hospital, and we installed SmartFlow there. I remember that.
Yes.
And then since then, you moved on and you're in VetNOW. So can you tell us about VetNOW and what do you guys do?
Well, it is great to have the chance to catch up with you, Ivan, and to speak with both of you again, really about VetNOW and how we were created and where we've gone since. We started VetNOW at my hospital in Pittsburgh, actually, and we started it because we were having trouble recruiting specialists to join our staff. We opened the hospital about 4 years ago and founded VetNOW about 2 years ago at this point, as we looked to human medicine to see how they were solving shortage issues. In the veterinary world, we're facing multiple shortages, including specialist shortages, large animal vet shortages, and really facing a general vet shortage now is really what we're looking at in the industry. And so we first created VetNOW to bring specialists into our own hospital to work with our ER doctors and general practice doctors on site. And that was by live video, sharing of diagnostic images, sharing of medical records, and really having both vet to vet and vet to vet with client included conversations and consultations. We created our own software then to support these interactions, as the human software platforms that were out there really didn't meet all the needs of the veterinarians. And since then, we've separated from the hospital. And we've also grown what we're doing to really include all of those shortages, all of those distribution issues that we face, around the world. And so those have existed prior to COVID, but they've only been exacerbated since COVID-19. And so we've really grown into the large animal space. We've grown into the university and the teaching space, and we've grown into some more unique areas like our collaboration with, the Smithsonian to focus on some more exotic and wild animal care too.
This is awesome. So COVID hit and everybody talks telemedicine.
Mm-hmm.
There are distinct differences between professional helping a client, which there is a bunch of VCPR laws around, and is different from professional helping professionals. So which category do you fit in? And then what are the regulations and what do you know about that?
Right. So really we focus on that professional to professional aspect of what we're doing. So yes, in the small animal, companion animal side of things, that is vet to vet work. When you're looking really at the large animal side of the company and side of what we do in veterinary medicine, it's often vet to a skilled farmhand or a rancher. They have a lot of skills, a lot of capabilities that they're already using. And when we're specifically talking about wild animals in isolated areas, it's vet to zookeeper or vet to gameskeeper, or, someone like that that's on the ground handling the animals with skill every day. So really it's about, getting an elevated level of expertise to someone that can do something about it. Now, we recognize that we kind of have to build an end-to-end solution and service. So vets can speak to their clients directly through our software, but we really, the focus of our company has been on kind of that professional level interaction, although there are a variety of professionals involved.
Excellent. And then, so when you're establishing that relationship, it's interesting because we never had anybody from the zoo sort of industry. And how is that covered by the current laws? Is there, with the zoo animals, I have no idea is there a VCPR? Who is the owner?
Right. So basically, when we're really talking about what we're doing right now, just as a bit of background, the Smithsonian National Zoo specifically, and there are many other organizations like this, they have a conservation institute that deploys vets from the US and Europe to about 30 different countries in Southeast Asia and Africa to help with particular endangered species there. And so it's rhinos in Kenya, and it is orangutans in Indonesia, and it's gorillas in the Democratic Republic of the Congo and Rwanda specifically. And so the vets have, over time, they've built a relationship with, the people on the ground there, the people in these, the governmental organizations, the national parks, the reserves there, but they haven't necessarily, seen the animals in person before. However, we're really looking at a situation where we have to start asking ourselves in the veterinary profession, where is some level of care better than none? And we have to kind of leave things up to the veterinary professionals in these cases. There really aren't laws and regulations surrounding what can be done internationally, right? When you start to cross borders, it's frankly within the US and Canada, there are already a lot of questions raised, right? When you're using telemedicine across borders, across state lines or provincial lines, what does that mean? How do we manage that? How do we control that? And so when you start going beyond, those international geographic boundaries, it's really relying on the professional judgment of the veterinarian at that point.
It's absolutely incredible. You have all of this legislation, and we had an extended webinar that we did on the VCPR laws in California, specifically around telemedicine. And it's very interesting to think that there's all of these rules and regulations for these companion animals, but for endangered species, there's not. What do you think about that?
No, I mean, I think at the end of the day, all of the regulation is meant to protect the animals and protect the end consumers, the people that are, accessing the technology at the end of the line. And I think that, in general, we have to start looking at what's best for those animals, right? And so because it's better for those animals to have remote care involving experts from the US than to rely on, just the people on the ground. I think that actually, regulating that would stifle the ability to actually protect those animals in the end. So, this regulatory, it's quite a balance frequently, right? To try to figure out where less is more, essentially.
Yeah, and I mean, I think that just brings up such an incredible point. And, in this COVID world that we live in, are these regulatory bodies benefiting the animal and the consumer in all the cases? And I think I'm going to go out on a limb here and say no, they're not. And sometimes they're getting in the way of veterinarians helping animals, and that just doesn't seem to make a lot of sense to me. I don't know if either one of you want to build on that, or
it's true though, right? But thankfully, a lot of the veterinary boards out there have acknowledged that this time in crisis, especially, is a time that encouraging access is very important. So a lot of veterinary boards, with California being an exception to the rule, have actually encouraged more use of telemedicine, right? They've said specifically during these emergency periods, we can allow the veterinarian's professional judgment, the needs of the animal, the needs of the client to outweigh the risks. And we can allow you to practice some telemedicine without a VCPR, right? So there have been actually quite a few moves by veterinary boards to do that. And certainly have encouraged use of telemedicine in follow-ups, cases where the VCPR already exists, right? They've really encouraged that, we use that as much as possible. And so there has been, for the most part, positive moves in that direction.
Yeah, and I think that it's this whole common sense, right? And the commonality of common sense. And, like you say, you have a lot of boards that are making really great common sense decisions that may stick around forever. And I think that's a great question, April, is what does the future of telemedicine look like from somebody that's on the ground doing it every day? And what happens post-COVID? Because we had a great episode last week where we spoke with a guest about this, and she's on the ground and she thinks that there's a lot of slow adoption in this world and that maybe we missed an opportunity with COVID to have this stuff stick around. What's your opinion?
I think at this point, I would partially agree with that. I think there's been a lot of slow adoption in terms of formal adoption of telemedicine. However, vets have been practicing telemedicine for years, right? Vets have been sending texts and emails and making phone calls with their clients for years. And so, I think that COVID has really opened an opportunity for us to bridge that gap and start to help vets realize that they can do this in a more concerted manner. And by all means, COVID is not over. We're especially in the US, we're in the middle, if not still the beginning portions of this crisis. And so I think that we're going to see a lot more adoption over time, but it's slow adoption of the formal recognition of telemedicine. However, at the same time, there is much change, much that can be done with telemedicine beyond, this narrow view of this direct-to-consumer follow-up service, for example, right? This convenience for the pet parent to stay in home and, then be able to communicate, with their veterinarian from their house. There's a lot that we still can do with specialty care. There's a lot that we can still do with exotic animal care and farm animal care, large animal care in general, that, we really can grow into and expand that space far beyond this narrow view that's taken of the direct-to-consumer portion of telemedicine.
Great. So then the next question is, we've got a lot of people that are out there listening to this podcast on their way to work or, whatever situation they find themselves in, and they're a veterinarian and they've heard all the hype about telemedicine and maybe they've just tried it, maybe they haven't. What would you say to the people out there, your potential new customers, that they need to know, that they need to look at, that they really should have an understanding about so they can help advance their business?
They really need to think more about their business, right? They need to think more about where they're experiencing some pain points, because maybe it's not in the follow-ups with their clients, right? Maybe it's that they're having difficulty running curbside appointments right now. Well, guess what? You can actually implement some virtual care telemedicine solutions there. You can video chat with clients in the parking lot. They can see the appointment happening with their animals inside the facility if that interaction with clients is giving you some heartache. Are you referring too many cases to specialists, that are hours away and never seeing those animals again? Well, that's somewhere where you could start to provide some specialty consults in your hospital and keep those animals in-house. Are your specialists so far away that your clients aren't going to specialists, even though they need that level of care? That's somewhere else that you can utilize telemedicine. So they kind of need to do a 180, right? And stop thinking about like, oh, I have to implement telemedicine to do follow-ups with my clients because that's what I have to do. That's what COVID's necessitating right now. Start thinking about where you're really struggling in your practice and start to find out if there are solutions out there that help you address that through technology. That's really, the best way for people that are really starting to grasp this.
Yeah. I just want to shift gears a little bit and understand, what was your path to working with, this world of zoo animals? Because I remember you started with the specialist to specialist because you were looking for, in Pittsburgh, you were looking to, connect with the specialists in other areas. And now we're talking about gorillas, elephants, giraffes. Like, is that a common animal in Pittsburgh or what's
No,
going on?
no. We have a zoo, but that's about as close as we get, right? No, so it was all through this wonderful small world that is veterinary medicine, right? So when we began to work on telemedicine in our hospital, we were approached by Texas A&M actually, because they do have the first veterinary telemedicine department at a vet school.
Oh, cool.
So yeah, their dean was forward thinking enough. Their former dean now, Eleanor Green.
Is she gone?
She just kind of finished her tenure there. Yes, she's left, and they haven't replaced her formally yet. But yes, so she wanted to start a telemedicine department at Texas A&M. So they hired a professor or associate professor of telemedicine, and decided they were going to implement it across the school. And they're implementing and utilizing VetNOW as their software there. So we've been working with them over the last year to really specialize the software for their needs, both direct to consumer and specialist consultation wise. And the Smithsonian then found out about them, and so they approached us through Texas A&M. But the Smithsonian had a unique request, and that was not just to use our software, but if we could help them to design a kit with hardware that they could also deploy in these situations, to transmit ECG feeds and heart sounds and pictures, close-up pictures and microscope images and, things of that, so that they could really provide more diagnostic support on the ground. And so we endeavored with them to create that kit that they now have prepared as well. Unfortunately, because of COVID, that kit was deployed a couple times, but right now it's sitting with them in Washington, D.C. because they're unable to travel as well, or to ship it even reliably. So we designed both a kit, and then the kit also allows the connection through our software, of course, to work with them.
That's super cool. So with that, the design was with them. Do you see the application of this kit now somewhere in more traditional way rather than the remote, areas? And
well, still in remote areas, but with other animals too, right? So we plan to build many more out, working with the Smithsonian, to deploy in different regions. So the kit that they have right now is specifically intended to go to the Congo, to go to Virunga National Park, where they have an orphanage for gorillas there. And so
That's
they
awesome.
have a handful of orphan gorillas that, unfortunately, it's an area that's really politically unstable. It's really rife with poaching. Just a couple months ago, about 12 park rangers were killed very close to there, just in a conflict with poachers and with, some potential thieves and whatnot. So it's really unsafe for the Smithsonian vets to go there anytime. So that's really why they, want to deploy this kit there. And they have skilled zookeepers essentially on site at this orphanage to work with them through. But they also intend then to deploy the kit at another refuge they have for rhinos in Kenya, and then deploy it across Kenya to start to collect information in areas where they recognize there's high wildlife, livestock, human interface, where there's a lot of chance for zoonotic disease spillover, essentially. So that's one place that we have, the potential to deploy hundreds of kits actually in those regions specifically with them. We do have another place too where we're deploying them, and that is in Atlantic Canada. And so that is not as challenged in terms of, being a developing country, in terms of working with wildlife. We know there aren't really wild gorillas running around, in the Atlantic region in Canada, but they're still very geographically challenged. The areas, the Atlantic Veterinary College is on Prince Edward Island there. They have a lot of livestock experts there and a lot of large animal experts there. But to get sick, large animals to the vet school is very challenging because they're across a 9-mile bridge, which right now that bridge is closed to 99% of traffic, even due to coronavirus. So the thought being that to deploy these remote care kits, we call them, that are more specifically designed for large animal work, with farmers and with ambulatory vets across Atlantic Canada, to allow them to connect with the experts at the university and provide better large animal care that way as well.
That's amazing. So you work specifically with Atlantic Vet College.
Yes.
Cool. And as I mentioned, prior to the beginning, I graduated in 2006 from Atlantic Vet College, and it would be interesting. Who do you work with at the college?
In general, they've been very supportive of us, right? Like we've worked with their dean there and the clinical leads of both their small and large animal hospitals. Dr. Ben Stoughton is there. He's a large animal internist. And he's really been one of our main champions there too, and their ambulatory vet service as well, figuring out how to make all these connections, as their ambulatory vet service typically travels off the island to other provinces in the area too.
That's so cool. Out of the two, I think, locations, Pittsburgh being innovative, I think, but I don't know a lot about Pittsburgh, but I did go to school on PI. That's not the most innovative place in not just Canada, but North America.
They've spearheaded a lot of technical innovation recently. I think they've realized that, right? And so they have a Prince Edward Island Bio Alliance, they call it now, where they want to drive, technical innovation in biological type sciences into the island, right? So since they have a lot of resources there with the university, since they have, a lot of aquaculture happening there, of course, and the vet school and everything.
It's a big part of vet school, yeah.
Yeah, they really have recognized that. And so it's really neat to see the way that they're trying to develop that, because I think they realized that they were, behind in that area.
Yeah, that makes me a little proud of my alma mater. But we are coming to the end, and we like to ask two questions.
Yeah.
So is there a TED Talk, a YouTube video, a book, or something that you read or listened to or watched recently that you would recommend to our listeners to consume as an information as well?
Yeah, absolutely. So there's a TED Talk that is actually about Virunga National Park and someone that was there and working there during some bombing that occurred there several years ago. And so there was actually a paravet in the national park that was taking care of both the gorillas and the people that were injured in the bombing. So that's one that's not specific to current situation, but is very fascinating. I would definitely encourage listening to that. And then recently I've been reading the Harvard Business Review about the COVID response, actually, and talking about world leaders and how they've, been in the COVID response, and talking a lot about female leadership in COVID response, actually, too. And that's been fascinating to me. So I would definitely recommend that too.
Awesome. And then the last question is another person that you would consider an innovator in the vet space that you think we should have on our show.
Okay. So there are really kind of two people. So Lori Teller, first of all, is a veterinarian who is the professor of telemedicine at Texas A&M. And so she's really been, doing this for more than a year now, really working through the intricacies of how to actually stand up a telemedicine program at a university across, I think, 15 different departments now, trying to, work this into multiple different facets at their hospital. So I think those real world experiences would be great. And then the other person that I would think of would be Jason Johnson, who is the dean of Lincoln Memorial's vet school. And he was one of the co-founders and also was the executive director for their Center for Animal and Human Health in Appalachia for a time, or Appalachia, like they say it in Tennessee, in that part of the region. They are really, really focused on, as I mentioned, veterinary shortages and distribution issues go far beyond specialty care. And so Lincoln Memorial's mission and focus is to train veterinary professionals and get them into primary care practice in rural areas, particularly in Appalachia. And so that mission and acknowledgement of the difficulties of veterinary care in rural areas, healthcare in general, and then, how you create that sort of training is pretty fascinating.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website, at veterinaryiinnovationpodcast.com. See you next week.